We've all been there. We're sitting with a client and we know that they've experienced trauma, but maybe they don't know that they've experienced trauma. And they might say things like, I let it happen, or it wasn't that bad. But we know it was that bad, and we know what it was. It was sexual coercion. But you just might not know what to say next to them. You can see how it's affecting them, their sleep, their relationships, their self-esteem, their sex life, their boundaries, and on the list goes. And they think that they have anxiety or depression, and they're coming to therapy for help with those things. But really, you know what's going on is underlying trauma, and they need extra support and help in addressing that trauma. And it's really tricky. It's a legal gray zone. There's a lack of training on how to expertly navigate this very delicate topic. And then there's this whole concept of what counts as trauma. Hint, I think that coercion counts as trauma, and I hope you do too. In my practice, I see this all the time. I specialize in the treatment of sexual trauma, and coercion is a really common thing that happens, unfortunately. I've been in the field for nearly 20 years, and I've seen countless cases of sexual coercion. It's a topic that I'm deeply passionate about and one that I love helping people recover from. And it happens to be something I'm really good at. Clinicians ask me for consultations all the time, and they ask questions like, do I name it for them? Do I tell them it was an assault if they're not calling it an assault? What if they don't see it that way? What are my legal obligations? It doesn't meet the legal threshold of assault, so what do we do about it? What do I say? How do I say it? What if they're still in touch with the person? They're still in a relationship with that person. What do we do? How do we address hypersexuality? How do we address hyposexuality and all the other things that happen to their sexual life thereafter? So I took all the questions people have asked me and all of the things I've learned about sexual coercion over the years, and I've put it together in a course offering you 8.5 CEUs. I designed this course with you in mind to help you navigate all of this with your client. I want to help other therapists learn how to help their clients heal from sexual trauma and reclaim their lives. I created this course because I am deeply passionate about helping people recover from sexual trauma, and I want to help you be the best therapist you can be so that you can help people recover as well. This is a fully asynchronous course. That means you get to decide when you take it, where you take it, for how long you can take it at any time. So there's no need to cancel a full day of clients. You can work this into your life. There's also no pressure as to when you have to take it. If it doesn't fit your life right now, that's okay. It's asynchronous. It's here when you're ready for it. And I know how therapists like to learn. I've been a professor before, and I've taught many other CEUs. Therapists want skills. They don't want another training of someone droning on and on and on about theory. No. Yes, we'll talk a little about theory, but really, this is a course designed to give you skills and techniques and interventions that you can use right away with your client. It is an advanced skills course. You're going to learn techniques and practice them through a workbook that I created that guides you through every single lesson. You'll be presented with different case examples. One of them will span the entirety of the course, so you can follow along watching someone fully recover from beginning to end. But you'll also practice with a few other examples here and there, and you'll get the chance to apply it to your cases as well. Every lesson is broken down into bite-sized chunks to help you retain the knowledge. There are 25 lessons that span 5 modules. Each lesson ranges from 5 to 20 minutes, and you can start and stop whenever you want. At the end, you'll take a quiz to show off what you learned, and that's when you'll get your 8.5 CEUs for social work or mental health counseling, approved through ACE or NBCC, respectively. So here's some of what we'll go over in the course. In Module 1, we'll go over what is sexual coercion, its legal and clinical definitions, as well as what is consent and what is trauma, and you'll have an in-depth understanding of all of those variables by the end of that module. Module 2, we're going to jump into setting the foundations of clinical interventions, the early stuff you're going to do with clients to start getting them ready for the trauma interventions. Module 3, we're going to go over how valuable psychoeducation is in this work and how to deliver it effectively. Module 4 is when we really dive into a lot of the nuances of clinical interventions, from helping you practice developing skills in Socratic dialogue, teaching you how to help clients process the information, helping clients reestablish safety and trust in their own lives, and reclaim their sexuality. Lesson 5 discusses countertransference, ethical judgment, and helps really wrap everything together. There's so much detail in this course, I can't even begin to cover in this short video. But if you're interested, I've linked the website to the course so that you can learn a lot more about it. I really hope you enjoy this course as much as I've enjoyed making it. I hope it serves you well so that you can continue to serve your clients. Thank you so much, and I hope to see you in the course.